Welcome to COVID Conversations, a group of videos and documents intended to guide you during these uncertain times. This video will provide you with the tools to discuss COVID-19 with your students and children. This video and the accompanying documents were produced by the Central Shenandoah Health District. This is an outline of the presentation. We're first going to talk about general COVID-19 information and answer some questions like, what is COVID-19? How is it spread? What are the symptoms? And how can you prevent the spread? Next, we are going to give you some tips on talking about COVID-19 to prepare you and guide your conversations. Before you start a conversation about COVID-19, it's important to understand what it is. So COVID-19 is the short name for coronavirus disease 2019, and it's a new virus. You may have heard it referred to as coronavirus or SARS-CoV-2. COVID-19 is a type of coronavirus and is caused by the virus SARS-CoV-2. Throughout this video and the other documents, we'll be referring to it as COVID-19. COVID-19 is primarily spread from person to person through respiratory droplets caused by coughing, sneezing, and/or talking. You may also be able to get it by touching a surface or object that has the virus on it, and then by touching your mouth, nose, or eyes. We are still learning more about how to spread. Scientists and doctors are still learning more about this virus every day. There are many symptoms of COVID-19, and they can be seen on this slide. If you or any of your students have any of these symptoms, you should work through the channels identified by your school. If you or any of your students are experiencing any of these emergency warning signs, which can be seen on the right side of the screen, you should seek emergency medical care immediately. These emergency warning signs include trouble breathing, persistent pain or pressure in the chest, new confusion, inability to wake or stay awake, and bluish lips or face. There is currently no vaccine to protect you against COVID-19. The best way to protect yourself is to avoid exposure. This slide includes some things that you can do to protect yourself. These recommendations include staying home as much as possible, which means only leaving your house to make essential trips like going to work, getting groceries, and picking up medications, wearing a mask in public, cleaning and disinfecting frequently touched surfaces, washing your hands often, and then following any prevention measures listed or set out by your school. Children may be worrying about many things during these times. As a trusted adult in their lives, you can play an important role in helping children understand what is going on in the world. It's important to help them make sense of what they hear and see in a way that is honest, accurate, and minimizes anxiety and fear. It is important to remember that children may have been impacted differently by this pandemic. There are some children whose loved ones may have been infected, others may have parents who are essential workers, and some may have even lost loved ones. It's important to be prepared to have a variety of conversations before you. It's important to be prepared to have a variety of conversations. Before you start, assess how you're feeling, since that will set the tone for the conversation. This slide has some important steps to guide your conversations about COVID-19. As we mentioned before, first, assess how you're feeling, as this is going to guide the conversation. Second, ask children what they already know about COVID-19 and correct any inaccurate information they share. You should show them how to identify correct information and where they can find it, such as on the Centers for Disease Control and Prevention website, through the Virginia Department of Health, or the World Health Organization. They might be experiencing information overload, so it is important to show them credible information sites and warn them that everything they see on social media might not be accurate. Third, ask children how they feel and acknowledge the wide range of emotions they might have. Fourth, provide facts and reassurance. For example, children usually have mild cases, or we're doing everything we can do to protect you. Lastly, reinforce what they can control. There are many things that you and children can do to prevent the spread, including wearing masks, practicing social distancing, washing hands. Remind them of the resources that are available to them at school and leave room for questions. If you do not know the answer to a question, don't make up an answer or guess. Acknowledge the question and let them know that you will get back to them. This slide includes more tips to guide your conversations about COVID-19. You know your students and children better than anyone else, so that is one of the most valuable tools that you have. Students and children have experienced different forms of trauma over the past few months, so it's important that you provide stability and support as they begin to explore their emotions around COVID-19. Some tips include: remain calm. Reassure children that they are safe. Make yourself available to listen and talk. Avoid language that might blame others or lead to stigma. Pay attention to what children see or hear on TV, radio, or online. Provide information that is truthful and appropriate for the age and developmental level of the child. Teach them everyday actions to reduce the spread of germs. If you have any questions after listening to this video or reading the accompanying document, send us an email at cshdinfo@vdh.virginia.gov. You can also visit vdh.virginia.gov/coronavirus for more information about COVID-19 in your area.